Hello students, today we will discuss about the glossopharyngeal nerve. You know that this is the ninth cranial nerve. So today we will discuss about the ninth cranial nerve, and that is glossopharyngeal. Now when you will see the glossopharyngeal nerve, the first and most important thing is that it is a mixed cranial nerve. What does it mean? That means it is carrying the both motor as well as sensory components. So it is a mixed cranial nerve. But when you will see the motor and sensory, you will realize that it is a predominantly sensory because the motor fibers are only for a single muscle. And you know that muscle comes from the third pharyngeal arch, and that is the stylopharyngeus muscle. That's why it is known as nerve of third pharyngeal arch. But there is one more question, that there is a branch is known as tympanic branch of glossopharyngeal nerve. Now this tympanic branch of glossopharyngeal nerve considered as a pre-trimetric nerve of second arch. So this is the question, that which is a pre-trimetric nerve of second arch. Now in this diagram, if you will see, you can see the arches are there. This is the inner lining, this is the outer lining. Now in between you are having the arch. This is the first arch, second arch, third arch. Now inside each arch you can see that there is a main nerve. So you know that first arch is having the mandibular nerve, second arch is having facial nerve, third arch is having glossopharyngeal nerve. But you can see that this third arch, which is having the glossopharyngeal nerve, is giving a branch, and this branch is your tympanic branch. Clear? So sometimes you have this question, tympanic branch of glossopharyngeal nerve represent, answer is pre-trimetric nerve of second arch. Now there are always functional components related with the cranial nerves. So what are the functional components of your glossopharyngeal nerve? So you will find there are total 5 functional components. 2 functional components are motor, or you can say efferent, and 3 components are sensory, or you can say afferent components. Now when you will see the efferent component, this ninth cranial nerve supply 2 sets of the muscle. One is the skeletal muscle, which is derived from the your brachial arch. So this component is known as spatial visceral efferent component, and for this component you have the nucleus ambiguous. Then you will have the second set of the muscles which are supplied by the glossopharyngeal nerve. These are the smooth muscles, and they are receiving the parasympathetic supply, and that's why this component is known as journal visceral efferent component, and these fibers will come from the inferior salivatory nucleus. So you have to keep this thing in mind, that the glossopharyngeal nerve is supplying a skeletal muscle and the smooth muscles. Now these skeletal muscles are arising from the pharyngeal or the brachial arch, and that's why this component is known as spatial visceral efferent. Second thing is that it is supplying the smooth muscles, and these muscles are having the supply from the inferior salivatory nucleus, which is actually autonomic. That means the parasympathetic supply. Clear? Now when you will see the sensations carried by the glossopharyngeal nerve, because we are saying that it is a mixed nerve. So which are the afferent components? So first is that it carries the taste sensation. So that is known as spatial visceral afferent component, and the taste is carried by the glossopharyngeal nerve, will go and terminate in the nucleus tractus solitarius. Then you will have the another component, and that is known as journal visceral afferent. Now this journal visceral afferent component comes from the 2 spatial dilatation of internal carotid artery, which are known as your carotid body and carotid sinus. So from there you have the baroreceptors and chemoreceptors, and these fibers will also go into the nucleus tractus solitarius. Then you will have the one more component, and this component is known as journal somatic afferent. Now this journal somatic afferent component carries the general sensation, or you can say the common sensations like touch, pain, temperature. Now these sensations comes from the posterior 1/3 of the tongue, it comes from the palatine tonsil, oropharynx, mucosa of middle ear. It also carries the sensation from the auditory tube and mastoid air cells. Clear? So in short, when you are reading the glossopharyngeal nerve, this slide is become very important to keep in mind that which are the areas supplied by the glossopharyngeal nerve. So you can divide this into the two part, motor and sensory. Motor, only two sets, one is the skeletal muscle which arising from the pharyngeal arch, and this component is become spatial visceral efferent. Then you will have the another set of the muscle which are having the parasympathetic supply. So, but obviously there are involuntary muscles and these are present in the salivary glands, and it is known as general visceral efferent component. Then you will have the sensory component. So, sensations comes from the three different components are there. One is the spatial visceral afferent which carries the spatial sense of the taste. Then you will have general visceral afferent. It carries the sense from the your chemo and baroreceptors present in the carotid sinus and carotid body, and general somatic afferent which carries the common sensations of the touch, pain, temperature from these areas of head and neck. Clear? Now, so what are the nuclei are responsible for these all components? So there are list of the nuclei. So this is again the very important question for your multiple choice, which of the following nuclei related to the glossopharyngeal nerve. So when you are having the nuclei, mainly we will read the four nuclei which are related with the glossopharyngeal. So you will have the both set of the nuclei, motor nucleus as well as the sensory nucleus. So first is the nucleus ambiguus. Now this nucleus ambiguus is a motor nucleus and it is responsible to supply the muscle, and that is stylopharyngeus. Then you will have inferior salivatory nucleus. It is responsible for the parasympathetic supply which is carried by the glossopharyngeal nerve. Then we will talk about the sensory supply. Now see, we have seen that there are three components for the glossopharyngeal nerve, but the nuclei are only two. The components are the three, but nuclei are only two. The first nucleus is nucleus of tractus solitarius and another nucleus is spinal nucleus of trigeminal nerve. So whenever you are having the list of the nuclei of glossopharyngeal nerve, you have to keep in mind these four nuclei: nucleus ambiguus, inferior salivatory nucleus, nucleus of tractus solitarius, and spinal nucleus of trigeminal nerve. So let's discuss these nuclei one by one. So first is the main motor nucleus. Now the main motor nucleus is your nucleus ambiguus. So the first question comes is, where is the location of nucleus ambiguus? So you will find this nucleus ambiguus in the medulla oblongata, deep to the reticular formation. Now these nucleus ambiguus is not only the nuclei of your 9th cranial nerve, but this is shared by the 9th, 10th and the cranial part of the 11th cranial nerve. So three cranial nerves are sharing the common nuclei, and this is a motor nuclei. So there are large motor neurons are present and it receives the control from the brain. That means the corticonuclear fibers from the both sides. That means a bilateral control is there, and the efferent fibers supply the stylopharyngeus muscle, that is the nucleus ambiguus, which fibers are going along with the glossopharyngeal nerve. So in this diagram, if you will see, this is your nucleus ambiguus. Now this nucleus ambiguus is an elongated nuclei which is present in the whole length of your medulla oblongata, but its upper part, now this upper part is having the neurons which are going to supply the stylopharyngeus muscle that is arising from the third pharyngeal arch. Clear? The next nucleus is the parasympathetic nucleus, which is inferior salivatory nucleus. Now this inferior salivatory nucleus also present in the medulla, but you will find this in the upper part of the medulla. Now this inferior salivatory nucleus is responsible for the preganglionic parasympathetic fibers which are carried by the glossopharyngeal nerve. But the question is here. Now there are few important points about this nuclei, that this fiber receives the input. This nuclei receives the input from other sources. So what are the other sources? Suppose this is your inferior salivatory nucleus which is present in the medulla. Now this nucleus receives the fibers from three sources. One is hypothalamus. The first source is hypothalamus. Now this hypothalamus, you know that it is a center to control the autonomic system, and we are saying that this inferior salivatory nucleus is a source of preganglionic parasympathetic fiber. So but obviously this is under control of your hypothalamus. Second, it also receives the fibers from the olfactory system, and it also receives the fibers from nucleus tractus solitarius, which is a center for the relay of taste. So there are three fibers which are coming here. One is from the hypothalamus, second is from the olfactory system, and third is from nucleus tractus solitarius. Now the important question comes so many times, that is there any relation of this inferior salivatory nucleus with thalamus? So you have to keep in mind, thalamus is having no relation with inferior salivatory nucleus. It is actually hypothalamus, not the thalamus. And these olfactory fibers and taste inputs which are reaching here are helpful in modification of your salivation. Clear? So these are the three important inputs which are reaching to the parasympathetic nuclei of glossopharyngeal nerve. The efferent fibers which are preganglionic will come out, and you know that there is a tympanic branch of the glossopharyngeal nerve that will enter into the middle ear cavity, and that is also known as Jacobson's nerve. Clear? And then you will have the formation of the tympanic plexus. From there you have the lesser petrosal nerve that ultimately will relay into the otic ganglia. So whenever you are reading the glossopharyngeal nerve, this inferior salivatory nucleus is an important source of preganglionic parasympathetic fibers. The next nuclei is your upper part of nucleus tractus solitarius. Now this is become important, upper part. Now why upper part? Because I told you, you have the three afferent components. The sensory components are three and nuclei are only two. One is nucleus tractus solitarius, another is spinal nucleus of trigeminal nerve. So you will realize that this nucleus tractus solitarius is responsible, or is a relay station for the two afferent or the your input sensory functional components. So first is your spatial visceral afferent. Now spatial visceral afferent means the fibers, those are carrying the spatial sense of the taste. So the sensations of the taste travel through the peripheral axons of the nerve cells situated in the inferior ganglia of glossopharyngeal nerve. So here again the new term come here is inferior ganglia. So we will discuss this in detail in the coming slide, but here you have to understand that the upper part of the nucleus tractus solitarius is responsible for the spatial visceral afferent component, and these taste fibers then will go and relay into the thalamus, and from here it will go into your cerebral cortex. So the important thing is that the fibers, those are entering into your brain stem, which are carrying the taste, are present in the inferior ganglia of glossopharyngeal nerve. The next afferent component is the journal visceral afferent. Now this part is again, here you can see the same nucleus, nucleus tractus solitarius, but here it is caudal portion. So that's why I told you, you have the three afferent functional component, but nuclei are only two. So in the previous slide you have the spatial visceral afferent, here you have the journal visceral afferent, and both kind of the functional components or the inputs are relaying into the nucleus tractus solitarius, but in the different part. Here it is the caudal portion of this nucleus, and this portion is actually cardiorespiratory nucleus. So the afferent impulses which are coming from the carotid body and carotid sinus. You know that carotid sinus is a baroreceptor while the carotid body is a chemoreceptor, and these fibers will travel with the pharyngeal branch of the glossopharyngeal nerve, and they will ultimately relay into the lower portion of this nucleus tractus solitarius. So they terminate in the nucleus of the tractus solitarius, and they are also connected to the dorsal motor nucleus of vagus. The carotid sinus reflex. Now this carotid sinus reflex involve the glossopharyngeal nerve and vagus, and they assist in the regulation of arterial blood pressure. Clear? So ultimately you have to understand that nucleus tractus solitarius is having the input from the two different areas. One is the spatial sense, and that is spatial visceral afferent, which is carrying the taste, and you will have general visceral afferent, which is carrying the sense from the your carotid body and carotid sinus. Then you will have the one more sensory nuclei, and that is the spinal nucleus of trigeminal nerve. Now here in the name itself, it is the basically a nuclei of your fifth cranial nerve. Now this spinal nucleus of trigeminal nerve is a very long nuclei, and this nuclei is receiving the general somatic afferent fibers. That means the common sensations like touch, pain, temperature, and all the cranial nerves which are carrying such kind of the general somatic will go and relay into this spinal nucleus of fifth cranial nerve. So the spinal nucleus of fifth cranial nerve is having the fibers from the other cranial nerves also. So that's why we are reading this cranial nerve nuclei here in the glossopharyngeal also. So afferent informations which are the common or general like touch, pain, temperature, and the another question comes here is that which areas of your head and neck supplied by the glossopharyngeal nerve. So these are the important areas from where the touch, pain, temperature or the common sensation carried by your glossopharyngeal nerve. So first area is your auditory tube, then the tympanic cavity, then inner surface of the tympanic membrane. You know that these areas are supplied by the tympanic branch of the glossopharyngeal nerve, then mastoid antrum and mastoid cells. The peripheral axons of the nerve cells situated in the superior ganglia. So now here you will realize that there are two ganglia in the glossopharyngeal nerve. One is superior ganglia, another is inferior ganglia. Inferior ganglia is having the neurons which are carrying the taste, while the superior ganglia is having the neurons, those are carrying the general or common somatic sensations. The central process end in the upper part of the spinal nucleus of trigeminal nerve. Clear? So these are the four nuclei and five functional components of glossopharyngeal nerve. Now we will discuss the ganglias. As we have discussed, there are two ganglias. So the trunk of the glossopharyngeal nerve is having the superior and inferior ganglia. The inferior ganglia is also known as petrosal ganglia because it is going to make or it lodges inside the petrous part of your bone. Clear? So both ganglia contain unipolar neuron. So this is the first question. It contains the unipolar neurons for somatic and visceral sensations. The inferior ganglia is the larger one and it lodges into the depression in the petrous part of your temporal bone. Clear? So when you are having the sensory ganglia, you have to understand that there are two ganglia. One is the superior, another is the inferior ganglia. Inferior ganglia is also known as petrosal ganglia, and these ganglia are having the unipolar neurons, and the inferior ganglia is larger one which lies in the petrous part of the temporal bone, while the superior ganglia is considered as a detached part. It is considered as a detached part of the inferior ganglia. And the important thing which is very commonly asked question in your exam, that the inferior ganglia is having the neurons which are concerned with the taste, while the superior ganglia is having the neurons which are related with the journal sense. Clear? Now here in this diagram, you have to understand this concept that this is your neurons which are present in the inferior ganglia. Clear? So this neuron is having the body and it is having the central process and the peripheral process. So this is the body of the neuron and this is its peripheral process, this is its central process. And we are saying that inferior ganglia is related with the taste. That means the peripheral process are taking the sense from the tongue or the other areas from where the taste buds are present. And the central process then enter inside your brain stem and it will relay into the nucleus tractus solitarius. So this is how it is arranged. But when you are talking about the superior ganglia, it is having the neurons which are concerned with the journal sensation. So this is your superior ganglia and here again you will have the neuron which is having the peripheral and the central process. This peripheral process is taking the journal sensation from your middle ear, your tympanic membrane, mastoid antrum, and their central process is going inside and it will relay into the spinal nucleus of trigeminal nerve. So in this way you can see the arrangement of the neurons. So whenever you are having the sensory ganglias in glossopharyngeal nerve, you have to understand that these ganglias are having the neurons which are actually the first order neurons, and these neurons are having the peripheral fibers, those are coming from the receptors and their central process are relaying into the respective nuclei. Then how the glossopharyngeal nerve starts and what is the course. So first is when you will see the brain stem, you will find the exit of the glossopharyngeal nerve in term of rootlets. It is not a single nerve which will come out. There are multiple fine rootlets, those are coming out from the brain stem. And these rootlets are coming out from the medulla oblongata. But the question is not about this, the question is about this. That when you will see the exit of your glossopharyngeal nerve, more specifically, it will come out from the posterolateral sulcus. Now this posterolateral sulcus is a groove between the olive and inferior cerebellar peduncle. Now in this diagram, if you will see, you can see the ventral surface of your medulla. So this is your midline and on both the side of the midline, you are having the dilatation and these are known as pyramids. And more lateral to the pyramid, you are having the olive. Now, but when you will go behind the olive, you are having the inferior cerebellar peduncle. So, we are talking about the area that is behind the olive. So, when you will see the area behind the olive, you are able to see the exit of these nerves. So, these nerves are your 9th, 10th and 11th. So, this posterolateral sulcus is having exit of 9th, 10th and 11th cranial nerve, and today we are reading the 9th, that is the glossopharyngeal nerve. So, glossopharyngeal nerve exit through the posterolateral sulcus, that is the area behind the olive, and here you are having in sequence the rootlets of the 9th, then the rootlets of the 10th and lowermost the some fibers of 11th cranial nerve. So, here these uppermost fibers are of 9th and below you will have the fibers of 10th and 11th. Clear? Now, once the cranial nerve, this 9th rootlets will come out from the medulla, these will go laterally in the posterior cranial fossa. And you know that finally this now has to come out from the jugular foramen. So, before exiting from the jugular foramen, these rootlet merges to form a trunk of the nerve. Clear? The rootlets will not come out, they will merge and form a single thick nerve that is going to come out from the skull. While passing through the jugular foramen, it grooves the jugular tubercle and the superior and inferior ganglia are situated on the nerve trunk here. So, where you will find the superior and inferior ganglia? Superior and inferior ganglia are present in the nerve trunk. Clear? So, from the inferior ganglia, the trunk bends sharply downward and leave the skull through the jugular foramen. So, in this diagram, you can see that this is your jugular foramen. Now, through this jugular foramen, your cranial nerve will come out. So after taking origin, the fibers are going laterally, and once the fibers will approach laterally, they will make a single nerve trunk, and this nerve trunk is going to come out from the jugular foramen. But before it exits, there are two dilatations present, and these are known as superior and inferior ganglia of glossopharyngeal nerve. The jugular foramen is divided into the by the two transverse septa into the three compartment. Clear? So suppose this is your jugular foramen. This foramen is divided into the three compartment by the two transverse septa, which may ossify sometime. And there are three compartment: anterior compartment, middle compartment, and posterior compartment of jugular canal or jugular foramen. Now this glossopharyngeal nerve and inferior petrosal nerve shares the anterior compartment. So anterior compartment is having the glossopharyngeal with inferior petrosal sinus, while the middle compartment is allow exit of vagus nerve and 11th cranial, that is accessory nerve, and the posterior most compartment is the largest compartment, and it is having exit of your internal jugular vein, which is actually the continuation of terminal part of sigmoid sinus. Clear? Now, so we have seen the intracranial cords, that the rootlets will arise, they will come out from the medulla, then it will go laterally and they will reach to the jugular foramen, and ultimately they will form the two ganglia. Now from the inferior ganglia there is a bending occurs, and after bending this nerve descends through the upper part of the neck. So when you will see the exit, first you will find in the upper part of the neck the nerve is descending, but when it will descend, it is always run along with the internal jugular vein and internal carotid artery. As the glossopharyngeal nerve completed descent, now it goes deep to the styloid process and the muscles attached to the styloid process. Finally, the nerve descends posterior to the stylopharyngeus muscle, then the nerve winds around the lateral side of stylopharyngeus muscle. So now in this diagram, if you will see that this is your stylopharyngeus muscle. This is your styloid process and this is the muscle. Now, where is the nerve? Now, if you will see the nerve, now we have seen that it first descends between the internal jugular vein and internal carotid artery, then it goes deep to the styloid process. So this is the styloid process and here is the nerve. Now the nerve will start to appear from this point and it is going here deep to the styloid process. Clear? Now what will happen, as this nerve will descend, first it will approach the posterior side of the stylopharyngeus muscle. Then it comes on the lateral side of the stylopharyngeus muscle. So you can appreciate this here. But in this portion you cannot see the nerve because here you have this external carotid artery and here this is the internal carotid artery. So what you can see is that the nerve and the stylopharyngeus muscle both are present in the gap between the external and internal carotid artery. So now the run forwards between the internal and external carotid artery in the anterior triangle of neck. So this is the question so many times you have in exam, that which of the cranial nerve present between the internal and external carotid artery, and answer is glossopharyngeal nerve. So here you can see that this is your external carotid artery, this is your internal carotid artery, and in between you have this nerve and this is your glossopharyngeal nerve, and this glossopharyngeal nerve is making a turn or it is creating a loop along the lateral side of stylopharyngeus muscle. So it passes forward and ultimately between the superior and middle constrictor muscle to enter into the pharynx. Finally, it goes deep to the hyoglossus, because you know the name itself is glossopharyngeal. So it is going to supply the tongue as well as the pharynx. So it will enter and terminate into the tongue. So in this way it is giving the terminal sensory branches to the mucosa of the pharynx and posterior third of the tongue. Now in this diagram you can see that this is your hyoglossus muscle and this is the entry point of your glossopharyngeal nerve, and after that you are not able to see because it go deep to the hyoglossus and ultimately approach the tongue. Now in these two diagrams, if you will see the course of the glossopharyngeal nerve, you will realize that this is the glossopharyngeal nerve, which is as soon as will come out, run into the anterior triangle of the neck. Now this is your cut section of the mandible. If you will complete this, now this is your lowermost part of the anterior triangle, that is known as digastric triangle. So it is very high in the digastric triangle, and this now will descend first deep to the styloid process, then it comes on the lateral side of the stylopharyngeus, then ultimately it will go deep to this hyoglossus. Now in this diagram, this is the posterior margin of hyoglossus. Now you can see that this is the nerve which is appreciable till here, but after that you can see the shadow of the nerve which is deep to the hyoglossus muscle. Now, what are the branches of glossopharyngeal nerve? Now, this question is very important for your viva purpose. So, the first branch is the tympanic branch or Jacobson's nerve, which is carrying the preganglionic parasympathetic fibers, and also it is sensory for your middle ear cavity, and it is known as your Jacobson's nerve. The second is the sinus branch. The sinus branch is also known as carotid branch, and it supplies the wall of the carotid sinus and carotid body, and here it joins with the branches of vagus and sympathetic nerve. Then you will have the pharyngeal branches. Now these pharyngeal branches are going to form pharyngeal plexus on the middle constrictor. But dear students, the important thing to understand that pharyngeal plexus is ultimately going to supply the pharynx, but there are sensory fibers also and motor fibers also. Here, when you are talking about the contribution of the glossopharyngeal nerve in the pharyngeal plexus, you have to keep in mind that the contribution of glossopharyngeal nerve in pharyngeal plexus is sensory, not the motor. Because when you are reading the muscles of the pharynx, you have this question that all the muscles of pharynx supplied by the pharyngeal plexus except stylopharyngeus, which is supplied by your glossopharyngeal nerve. But when you are saying that all the muscles are supplied by the pharyngeal plexus, it doesn't mean that glossopharyngeal nerve is also supplying the muscles of your pharynx. The muscles of pharynx are supplied by the vagus nerve, but this glossopharyngeal nerve, the pharyngeal branch, is responsible for the sensory supply through the pharyngeal plexus, not the motor supply. So please keep this thing in mind that this question has been asked so many times that pharyngeal plexus sensory contribution is by the pharyngeal branch of glossopharyngeal nerve. Then the other branches, muscular branch, you know that it is the only single muscle which is supplied by this is stylopharyngeus. Then you will have tonsillar branch. Now these tonsillar branches are again sensory and they will supply the tonsil, soft palate and fauces. Then you will have the lingual branch. It is not lingual nerve. Lingual nerve is a direct branch of the mandibular. It is lingual branch of glossopharyngeal, which is again sensory, and this is mainly responsible to carry the spatial sense of the taste which comes from the valate papilla of your anterior 2/3, which are posterior most placed papillas, and it also carries the taste from the posterior 1/3 along with the general sensation of posterior 1/3 of tongue. Now we will discuss some important applied anatomy related to the glossopharyngeal nerve. The first is carotid sinus syndrome. Now the carotid sinus, you know that it is situated at the proximal end of the internal carotid artery, and it is extremely sensitive to change in the arterial blood pressure. So when you will see the internal carotid artery, you have a dilatation here, and this dilatation area is known as carotid sinus. Now these carotid sinus are having receptors which are sensitive to maintain the arterial blood pressure. The distension of the arterial wall of this area due to very high pressure in the sinus causes a reflex slowing of heart rate and fall in blood pressure. What does it mean? That whenever the blood pressure is going to rise due to any reason, what will happen? The high blood pressure causing the dilatation of this sinus, and once the high blood pressure causes dilatation, the reflex is there is a decreased heart rate and there is a decreased blood pressure. Why it happens? Because of the carotid sinus, which is a normal condition. But what will happen in this syndrome? Now there is a stimulation of the sinus branch of the glossopharyngeal nerve, which connected with the cardio-inhibitory and vasomotor centers in the brainstem. But what will happen when there is a carotid sinus syndrome? There is a hypersensitivity. Now this is the important word you have to write in exam, that there is a hypersensitivity of the carotid sinus receptor. So what will happen? There is a carotid sinus reflex, or external pressure may cause the blood pressure to fall suddenly and produces cerebral ischemia, syncope and loss of consciousness. So if there is a excessive hypersensitivity of carotid sinus occurs, a small rise in blood pressure will give a very high reflex effect. And what is the effect? Decrease in blood pressure, decrease in heart rate. But it is beyond the normal limits. Now why it is beyond the normal limit? Because of hypersensitivity of this carotid sinus. So what will happen in the carotid sinus syndrome? In the carotid sinus syndrome, there is a hypersensitivity of this carotid sinus, and that will lead to the excessive fall in the blood pressure, that will lead to the cerebral ischemia, that will lead to the syncope, or sometimes there may be a cardiac arrest occurs. So you have to keep this thing in mind, that carotid sinus syndrome is a syndrome due to hypersensitivity of these areas. The next is gag reflex. Now this is again very commonly asked question, how to examine for the glossopharyngeal nerve. So when you are having the this gag reflex, you have to elicit by stimulating the posterior pharyngeal wall or soft palate. Now what is the normal result? The result is that there is an elevation of the pharynx, there is an elevation of the soft palate, and there is a retraction of the tongue. So you can see that when we are eliciting the gag reflex by stimulating the posterior pharyngeal wall, the three results are seen: the pharynx is elevating, the soft palate is elevating, and there is a retraction of the tongue. Now this reflex will lost in the glossopharyngeal nerve injury. Now the important question is, which nerve are carrying the afferent and efferent limb of this reflex? So the afferent limb of the gag reflex is carried by the glossopharyngeal nerve, that is your area which is supplied by the glossopharyngeal, and this is the posterior one third of the tongue. Clear? But when you will see the efferent or motor limb of the reflex, it comes with the vagus nerve, and this is supplying the levator of your palate and pharyngeal muscles, that is the constrictors. Clear? So when you will have the stimulation, the sensations are going with the help of the glossopharyngeal nerve, and the motor part is coming with the help of the vagus nerve. So the eliciting of reflex is not only checking the 9th, but it is also simultaneously you are testing the 9th, 10th and 11th cranial nerve. So this is again the question of your exam, that which of the following cranial nerves can be examined with the help of gag reflex. Why? This is because the 9th is the sensory limb, and the cranial root of the 11th, which joins the vagus to supply the palate and pharyngeal muscles, which are the motor root. Clear? So I just told you that whenever we are reading the pharyngeal plexus, in the pharyngeal plexus there is a contribution of the 9th, 10th and 11th, and 10th and 11th are responsible for the motor supply. So they are forming the descending limb or your motor limb of the gag reflex, while the 9th is making the afferent or ascending limb of the gag reflex. Then the last is earache associated with tonsillitis. Now this is again very commonly asked question, that this problem is generally seen in the children, and the question is, a child present with the tonsillitis and he is also having the complaint of earache. Why? So earache is very common symptom in the tonsillitis. The only answer is the common nerve supply. So you know that tympanic branch of the glossopharyngeal nerve is supplying the mucosa of the middle ear and inner surface of tympanic cavity. But the important relation is that the glossopharyngeal nerve lies in the tonsillar bed. So this is the important thing to understand, that this is the supply, but apart from that, this glossopharyngeal nerve also come in relation with the tonsillar bed. So whenever there is a repetitive attack of tonsillitis, this glossopharyngeal nerve compressed by the inflammation of the palatine tonsil, and it causes the referred pain in the ear of that individual. Clear? So at the end of this class of the glossopharyngeal nerve, I hope now you are able to understand that what are the functional components, what are the nuclei, what are the cores, and the most important thing is which are the areas supplied by the glossopharyngeal nerve, what is the use of the gag reflex, what is carotid sinus syndrome. So this is all for today's class. Thank you.